Hey guys, welcome back to Previa Alliance podcast. It's Sarah
and Whitney.
And today we have a very special guest in our Previa Alliance girls. You guys know Jenny.
Hi, I'm Jenny.
Because she is our lactation, soon to be adding in some new fun content for the 𝐥𝐤𝐬𝐬. But you guys know her right now for lactation if you're a Previa Alliance girl.
Yes.
But Jenny, welcome.
Thank you. I'm so excited to be here.
How about you start off giving us a little rundown? Tell the listeners a little bit about yourself, what brought you here, and where you are in your state of motherhood.
Okay, so I'm Jenny. I am a registered nurse, a board-certified lactation consultant, a DONA certified birth doula, and a mom of three. I have three little ones. Harris is 6, Charlie's 3, and Emma Grace just turned 1. I also just had a prophylactic bilateral mastectomy 2 weeks ago, so I'm feeling...
So she's superwoman.
Yes.
No, I feel very, very fortunate. I feel amazing. So it was preventative for the BRCA2 genetic mutation, family history, but I'm feeling really, really good. So excited about that.
Perfect.
Yeah.
So you're in the trenches with us with littles.
Yes,
we like to
absolutely.
say.
She gets it.
And you have 3, and nurse, lactation, doula, just the whole thing, plus having your own kind of health journey.
Yes.
And so we're so happy to have you here.
Thank you. I'm excited to be here.
So I think let's start off with lactation.
Yes, let's do it.
What is, from your eyes, I know you've seen mamas of all stages of lactation or breastfeeding. When we say lactation, we're talking about breastfeeding.
Right.
Yeah.
And what can you say that you see more than not when people, you visit them in the hospital or they call you and say, I need help? What are you seeing from these moms?
As far as like their needs
Their
go,
needs or even their attitudes about it, or just, I guess I always felt like I knew nothing when I started breastfeeding.
Yes.
And I felt almost like, oh my gosh, I'm supposed
Deer
to
in the
know
headlights
it.
Right.
kind of thing.
I think it's so much harder than you anticipate. Like in your mind, you think it's going to be this beautiful, natural thing, and it can be, but in the beginning, it can definitely be very challenging. So a lot of times, we have that overwhelmed mom. She might not be able to get her baby to latch, or she might be having pain. And that's actually what I went through with my second baby. Even as a lactation consultant, he had the tongue tie, the lip tie. I had a traumatic birth with him. It was just going through a lot. So I can definitely sympathize and empathize with the moms who I meet with.
And I think it's this Instagram thing we talk about too, right?
Yeah.
It's like, I'm going to birth this baby. It's going to be a magical, perfect birth, which does not happen for so many of us.
Yeah.
And the birthing process itself, if nothing, you would, even if everything goes as planned, you're exhausted. You're tired.
Right.
Milk does not always magically come in.
Right.
And here you are. And I remember they're like, just especially with James, because Will, they didn't allow me to do this because he was in the NICU. But James, they just shoved him up to my boob. And I was like laying there, and I just had an emergency hysterectomy. Oh, and I was just like, and they're like, he needs to feed. And I'm like, okay, please help me hold him. Yeah. And I'm just like, I was shaking because I forget what medicine they gave me, but like I was just like, I couldn't physically hold him.
Oh gosh.
And I was just like, I'm trying. And the nurse was like really just basically doing it. And I just remember I was like, this is not what I want in this moment.
No, that's not what you ever would have envisioned.
And I felt bad being like, I don't like this.
Right.
And I think moms don't want to say that sometimes.
Yes.
But like what I just went through, I was still kind of reeling in my head.
Absolutely.
So I think it's important to say, like, the first time may not be magical or pretty. It may hurt.
Yes. And I'm happy to share my own experience, kind of what led me to here, I guess. So with my second baby, I had a pretty traumatic delivery with him. And, as a nurse, I was never upset or angry about that delivery or even like the birth injury. It was just more the response afterwards that, he was 9 pounds, 9 ounces. It was a very quick, dramatic entrance into the world. And they were like, you're fine. Like, everything's good. And I was like, something is very wrong. I'm in debilitating pain. And, this went on for weeks and weeks that they were like, no, you're good. Everything's fine. And I started feeling like I'm crazy. Like, they're telling me nothing's wrong with me. And
do you feel like it was medical gaslighting?
A little bit, yeah. And, I'm a nurse. And so I'm like, I feel like they should be bringing me in the office or taking me to the OR or something, because I'm telling them I'm in this like horrible pain.
Yeah.
And I had, all these other symptoms too. I won't go like super TMI, but finally at my postpartum exam at 7 weeks postpartum, like
Oh my gosh.
the doctor couldn't even get the speculum inside me, like TMI, but she's like, something's wrong. So we do like
And
an
you're like,
ultrasound
really?
and an
Thanks.
MRI, and I have this massive internal hematoma that's
Oh my
like
gosh.
displacing my organs. And at that point, it was too late to do anything. And so I really just had to wait for it to dissolve. And it took 9 months. So I was in pain every day for 9 months.
Jenny.
So breastfeeding on top of this. This is my baby, my almost 10-pound baby that had a tongue tie and a lip tie. And so, I have a fantastic support system, with
Right.
my family. And really, I have so many people in the healthcare community that I could reach out to. But still, I just felt like I wasn't getting the support that I needed.
Yeah.
And so, it's hard. And I had firsthand experience with that. And
Yeah.
so, now looking back, I think when he was finally like 16 months old, I got to the point that I was like, wow, like that was not okay. And
Yeah.
I actually started seeing a therapist at that time, because I know
Good.
Whitney has talked about like those intrusive thoughts.
Yes.
And like my anxiety was just spiraling at that point.
Absolutely.
Like, for example, like one day we're at the golf course on a golf cart, and I'm like, my babies are going to fall off and hit their head and have a traumatic brain injury, or they're going to fall in the pond and drown. And, in my mind, I'm like, this is not logical. And so.
But it's a fear.
Yes. And so when I finally talked to someone, and she's like, as a healthcare provider, you have seen all this trauma.
Yeah.
You had a traumatic event, and it triggered this response that you just have to deal with it and process it. And I know Whitney can speak more to this than I can, but a therapist is not going to fix your life, but
Correct.
they can give you the tools to work through it.
Exactly.
And that was very beneficial for me. And
Good.
so that's, I think a lot of times when I'm helping moms breastfeed and I'm all up in, their personal space, like they share a lot of things with me.
Yeah.
And that's very sacred to me, to hold space for them. And,
Absolutely.
I always tell moms, reach out. Like, you do not have to suffer. And when I had my third baby, I was like, I will not wait 16 months. Like, I deserve to feel my best.
Good for
and
you.
for me and for my family. And
So true.
So that's just, my message for every mama out there.
And one thing I think that you brought up that's really important is that it happened to me as well, is like that initial reaction from healthcare providers. And it's odd because I'm a nurse like yourself. It's just, we've been in these.
Yes.
You worked in the hospital. You know, we've been in this where we've seen something happen to a patient and we're trying to make it better. And then it's us.
Right.
And we're going, believe us, that was not okay. And no one's saying, hey, what you just experienced was not okay.
Right.
You need to process this, or like that probably like impacted you, or I'm so sorry that your
Just
birth
some
experience was that
validation.
way.
Yes. And so when I had that MRI, and it was validation that like
I'm not
something is
crazy.
really wrong with me. Like, I wasn't going crazy. And then finally when I had my third baby, and I completely changed hospitals and practices, and the doctor I was seeing at the time like looked me in the eye, like you just said, and he said, if no one's told you this, like, I'm so sorry that happened. And I just burst into tears, and I was like, thank you. Like, I'm so glad someone acknowledged that. And so I think that's so important.
So needed.
Because it's hard, because you, and it probably is done to you, it done to me, but the baby's fine. He's happy.
Right.
You should be good.
Right.
Like,
Happy
you guys
mom, happy
survived,
baby.
right?
Yeah.
You're good.
Yeah, let's minimize everything by just focusing on the baby's okay, but is mom okay?
Yeah. And mom has to be okay for baby to be okay.
Absolutely.
And people don't, and I think this is why open conversations, what we're all about, is just saying, moms, like, our mental health is affected.
Yes.
And so we have to prioritize that. We have to talk about it. We have to get therapy if we need it.
Yeah.
We need to have resources.
Yes. And there's so much like shame and stigma around like therapy. Or, we also went through like the recurrent pregnancy loss. And when you talk about these things, like I had a traumatic birth, or I had miscarriages, or I had trouble breastfeeding, or like maybe I didn't want to breastfeed. And there's so much like stigma and shame around it.
It is.
And if we talk about it and bring light to it and don't hide it to make someone else feel comfortable. I just think
that's so important.
It is.
It changes the way we react to each other.
Absolutely. And I think now things are getting better with the stigma coming off of therapy.
Too.
But, you were my safe person after Sammy was born because I knew that I was going to formula feed. I formula fed straight from the get-go with both kids. But
and
I was
over
here.
That for you.
Yeah. And I was texting Jenny. I'm like, okay, the engorgement.
I'm like, let's dry up your milk, girl. Like,
yeah,
how
I'm
are we gonna do
texting
this?
Jenny. I'm like, so what all do I need to do? Like the ice packs and the peppermint oil aren't cutting it like it did the first time. What else do I need to do? And I knew Jenny was my judgment-free zone.
Yes.
She was my judgment-free zone.
Totally.
I knew I could go to her, and we all need that. And we are this space for you guys.
Absolutely. That's a really good point because I remember stopping breastfeeding with James for my mental health. And he had a dairy issue as well, and reflux, and just I was feedings were triggering me, and because it was so hard for him.
Right.
He actually latched and did everything better than Will ever could, but it was one of those things where like we're stopping.
Yep.
And I remember trying to dry up my milk, Googling. Okay.
Yes.
But to have a resource like you, so, and I know you'll probably do a series for this on our Previa Alliance for our women about how to dry up your milk.
Yes.
Because people don't tell you that.
Yes.
It's hard.
They don't tell you that. They don't tell you what to do when you get mastitis. OMG. I thought I was going to
I've
die.
never had it, but my friend Bethany did, and it was miserable for her.
Yes.
To describe the feeling was like my body had flu, my boobs were hard as rocks to the point like a shirt touching them, I wanted to scream and cry.
But you have to get that milk out.
So you have to pump, you have to
and
feed.
it hurts so bad.
And the baby up against you feeding, I mean, you just were like, and I had a toddler running around.
Yeah.
So the first time I had mastitis, this was after the traumatic delivery child, my second.
Of course, because
I have 2 babies at home. My husband was traveling a lot at the time, so he's out of town. I wake up at 4 a.m. That feeling you're describing, I've been hit by a truck. I have 103 fever. So I call the after hours OB. They're like, we'll call in this antibiotic to a 24-hour pharmacy. And so then I'm thinking, am I going to wake my babies up and put them in the car and drive across town? Like, no. So I just sat in the bathtub shivering until morning because that's what moms do.
Yeah, and we take one for the team all
that's
the time.
Right. So,
oh my God. And
we
so,
sacrifice
and that's an important part
so
to
often.
say. A lactation consultant got mastitis, guys.
Yes.
Like,
no one's immune from it.
You know, therapists get depression, anxiety. Lactation consultants get clogged ducts.
Yes.
They have difficulty breastfeeding.
We're human too.
We're all
no one
human.
is immune from life.
Exactly.
No. And like, that's why when we're seeking resources, we're asking for help. Like, no shame.
Right.
Yeah.
There is no judgment.
Because we're moms too. We're all just having these experiences. You know, I know there's doctors have had traumatic births and like they literally are OB doctors or high risk doctors and it's happening to them. So just with anything, like we're here just to have this conversation. Like, again, think of us as like the friend you want to have to give you the lowdown and dirty. Let's talk through a couple just like lactation situations. Okay. So say what's the hardest part? I think the hardest part is like the first couple weeks.
Yes. And so, like with just using myself as an example, I said I'm going to get to 12 weeks because a lot of times if moms come to me who have weaned and they want to relactate, typically they do this within the first 12 weeks. And so I'm like, I'm going to make it to that 12-week mark. So I always tell moms, like, if this is your goal, just push through those first few weeks, few months. That's the hardest. I think just getting that initial first latch, and I always tell moms, like, it should not be painful. And I think, you know, the grandmas always tell you, toughen those nipples up.
Yes.
And that's no, we do not want that. It should not be painful. You may have some tenderness for the first few weeks, but if it's painful, seek help. There's something going on that we can typically correct very easily.
Okay. And then how would you know, you said tongue tie, how could moms be like, even in their mind, think about that? What's some kind of like feelings or signs that they'd be like, ooh, okay, maybe I need to talk about like.
And so a tongue tie and a lip tie, a lot of times people just have it. It's a normal finding. But if it's causing an issue, we typically see like nipple trauma.
Like bleeding or cuts.
Bleeding nipples, painful latch where you're just like, lactation's seen me. He's got a good latch, but it hurts so bad I don't want to latch. And then, you know, baby may not be having adequate diapers, may not be gaining weight, that we're worried that we're not transferring milk.
Okay.
So if we see a tongue tie, lip tie, but everything is going great, then I typically say, like, just if it's not broke, don't fix it. People have different opinions about that, but I typically take a more conservative approach. But, if mom's having issues, baby's having issues, I typically say, let's go see a pediatric ENT or a pediatric dentist. You don't need a referral for that. You can call and make that appointment yourself. But a lot of times it's just positional, that I can come in and do like a very small position change, show you how to sandwich your breast, where to hold your breast, and they're like, oh my gosh, that
no one
made
teaches
all
you
the
this.
difference.
No one teaches you this.
And so this is why I think we need to start during pregnancy. Like,
oh, absolutely.
with all the things that let's take care of mama and teach her how to take care of herself, how to protect her mental health, how to breastfeed. And if we can do this prenatally, we will have healthier mamas and healthier babies.
That's why we encourage our Previa Alliance patients and women to, so basically we're like this digital library, like that's why Whitney's on there talking about what is postpartum depression, what is postpartum anxiety, what are intrusive thoughts. So when that happens to you, which happens to like most moms, you're not going, I'm going crazy.
Right.
You can say, this is this, and this is why. We're going to show you when you can practice, not when you're crying, sobbing, and your baby's screaming, I don't know how to do the football hold.
Right.
Okay, I don't know how to, because in those moments we're trying to tell people, like, sometimes you don't.
Cannot retain
you
information.
Can't. And that's not those times to have the conversations with your spouse about what you need.
Yes.
You have, so that's why we're so just like moms.
Equip now.
Let's talk
that
about
way
it.
when baby gets here, it's easier.
Because you're going to be in survival mode.
Oh,
even if things go perfect, you're sleep deprived, your body's hurting, it's been through a lot.
Yes.
I think another point we need to touch on is how can moms find lactation consultants?
So what's great now is a lot of insurance companies will cover in-home lactation support, which is great because especially after COVID, and now it's not even COVID, it's like flu and RSV, you don't want to take your baby to the hospital,
right?
To, especially if you have other children, to get support. So most insurance companies will cover in-home lactation visits. And so you can do just like a quick Google search in your area. You can call your insurance company. And if your insurance company isn't covering it, that's a great conversation to have. Like, hey, I want you to cover it.
Yeah.
But I would definitely call, again, prenatally, so you can have this lined up for
when you're
someone,
postpartum.
Yeah, for someone to come to your house. And so, like, I do in-home visits with Central Alabama Lactation Services. Most insurance companies will cover my services, and then you can pay out of pocket if it's not covered. But for the most part, they typically do cover.
And they also cover usually a breast pump, which I didn't know this. And I thought I had to go buy this. And then someone was like, oh, no, call your insurance. But I was literally, I remember this with Will, like 4 days post C-section. And I'm like, okay, so I got to like have someone drive me to like this medical supply store. And they're like, yeah, because you didn't, they were like, most moms do this when they're in their third trimester. I'm like, well, apparently I'm not most moms.
And you had a preemie child.
Yeah, and I'm like, I didn't think he was going to come 6 weeks early.
Right.
Yeah.
So that's another thing.
And some insurance companies won't even give you a pump
until you gave
30
birth.
days of your due date.
Yes. So I was like, hey, sorry about that. But I remember they kind of like shamed me. And I guess let's talk about.
That's what you needed.
That's exactly what I needed after I'm like, I feared for my life. Let's talk about NICU moms and lactation. Because that's kind of close to my heart.
Yes.
I felt I would have been very fortunate to have a you in this experience. I did not have a you. And I think just like no doctors, no therapists, no nurses, no lactation consultants, they're not all created equal.
Right.
And I was very much, I felt like Will's life depended on my breast milk. And I became obsessive with it. And I remember I was like, I have to power pump. I have to eat the oatmeal. I have to drink the blue Gatorade.
So much pressure.
And because I was like, I almost felt like my body had failed him. So here he is early, which I know that's a common theme I hear with moms in NICU and traumatic births. It's like, I did something wrong, which we did not.
Nope.
And then I had this lady just really be like, it's up to you. If you want him out of the NICU, give him breast milk. And that's breast milk is wonderful and vital, but to me in that moment, it was very detrimental.
Right. Oh, yeah. You needed to be a healthy mom.
Yeah.
So first and foremost.
So what do you say to maybe those moms who, like, our mental status is not okay? Like, our physically we might be, but we are in postpartum depression. We are in postpartum anxiety. We're like psychosis even.
Yeah.
What,
And
what do
it's
you
interesting
say?
you say that because I've worked like in NICUs and Children's Hospital, and when moms are, constantly at the bedside, but sometimes it's just the mental load. They're just not able to pump at that time, and that's okay. And I think that's why you have to have the conversation that, like, hey, is this your goal? And what's so great now is most hospitals have donor milk, and so
Which I didn't even know about.
yeah, and this, I feel like in the past few years, like it's starting to become more available.
I agree with that.
Which is good, which is amazing. My third baby actually had a little bit of donor milk in the hospital because she had low blood sugar. I mean, she was a 9-pound baby, and so it's coming available to like everyone, not just people in the NICU. But yes, encouraging, if that's your goal, to provide breast milk, but also looking at the family as a whole. Like, is this working for you? Are you okay? Like, are you sleeping on the couch 20 hours a day because you're severely depressed? And we need to address that.
Yeah.
And I think you have to take a holistic approach.
Agreed.
It can't just be about, like, I'm only looking at your boobs and, like,
Yeah.
what I can get from it. You have to look at the mom and the family as a whole.
Yeah.
I felt a lot of shame. So I always tell moms now, I'm like, listen, fed is best.
Yes.
And if you want to breastfeed, we're going to give you all the tools, all the support.
Yes.
We're going to empower you through this.
Yeah.
If you want to try it, doesn't work. If you get, I'm like, because then in my head, I always tell moms too, I'm like, have formula in the house. Because let me tell you, I was intrusive thoughts and I was like, what's if I got in a wreck? And Bill wouldn't know what to do. I can't have. What if I had surgery and I can't get the milk?
Formula shortage. I have so many moms like calling, crying, and it's just like heartbreaking.
And you feel guilty if you chose to stop for your mental health. You're like, now I can't even feed my baby.
Right. And I think as a lactation consultant, there's this line where, when moms need help, like I'm going to do, like you said, give them the tools, everything we can do. But at some point is that they just need permission.
Yes.
That you can give your baby a bottle of formula and it's okay. Like, do you need me to tell you that? Right. Like, your baby's going to be fine and healthy. And lots of babies are breastfed or bottle fed or combination fed, and they are fine.
And you can line them up and you would never say,
yes,
formula,
exactly.
breastfeed.
They're all eating Chick-fil-A off the floor by the time they're 3. So,
amen to that. I think
Why are you
just
calling me out about that Chick-fil-A? Like,
hey,
come
I
on
mean,
now.
mine do it too. It's fine.
I still have old Chick-fil-A fries in the back seat of my car seat somewhere. I
I'm
sense
in
the
good
teacher
company.
drop off judgment when she's like, that fry's still there. Because, they help them in and out. And I'm just like, okay, fine, I'll vacuum it tomorrow.
I'm
you
like,
know?
how long can I pull the mastectomy card? I'm like, I just had a mastectomy. Like, I'm totally fine.
As long as you need
it.
it.
Sounds really dramatic.
No, we're here for it. Keep doing it. Now, tell us about Doula.
Yes.
I want to know.
So, Whitney and I, after I had this traumatic birth, Whitney and I were actually working together at a hospital in a birthing, birth suite environment.
Yes.
What a perfect team. How lucky were those moms?
That's how we
Hello.
connected.
It
Now
is.
we're running buddies.
I love
right.
this. No, I love this.
Yeah, but so I was working with new moms at the time, and so I went to my boss after I had this traumatic delivery, and I actually birthed my baby at a different hospital, but I went to my boss and I was like, there is a huge gap. So you see your OB at least once a week,
Yeah.
right before you have your baby, and then you birth this baby. It can be traumatic, it can be easy, but whatever.
Yeah.
It doesn't matter what spectrum
No.
you're on. It's like you get one visit.
Good luck. 6 weeks.
Yeah. One visit, 1 to 2 months later, and that's it. And I was like, we are missing something here. I have an amazing support system, and I still was riding the struggle bus. And so what about
100%.
these moms that don't have the support? And so we actually, then COVID hit in 2020, and hospitals went to these visitor restrictions where these birthing moms could have one support person.
If they were negative.
Yes.
If they were COVID positive,
And
they
God
said all of
forbid
that.
they popped positive during that. Because I know several people that
I
are
was
like,
freaking out when I was
so-and-so
in
was
labor with
positive.
Sammy.
And like the anxiety of being like, what if they
Yes.
are? And then some
Yeah.
hospitals, they didn't even care. They're like, you get no one. There's
Right.
tons of
Yeah.
moms that
It
had
really
to labor and give
depended-
birth by
Right.
themselves.
It really depended at what point in 2020 they delivered. If it
Super
was March,
traumatic.
April, May, it was awful.
Yeah,
I mean,
so
that's
bad.
so scary.
Yeah, so really out of my traumatic birthing experience, it kind of birthed this idea during COVID, like, let's train. We took, I think, 12 labor and delivery nurses, DONA certified them, as birth doulas and offered it free of charge to anyone who wanted it, so that they could have their one support person, and then they could also have a birth doula with them.
Yeah.
And it was amazing to kind of fill that gap during that time. Because a lot of moms, maybe the father of their child wasn't their partner at the time, and they had to choose between the baby's father and like their mom or their sister, and it was very hard. And so having an additional support person at the hospital to kind of fill that gap was sort of where the birth doula idea was birthed. And so I love it. It like came from the fire, like from my traumatic experience.
Yes.
I feel like
purpose to pain.
Yes, totally. And even now I just feel like the more experiences I go through, like there is no room for judgment, because
no.
I mean, we are all human, and we all have our story, and I am just here to
help
support you. Yes, and to help you. And
so what would you say the biggest benefits of having a doula would be for a mom?
Yeah, so there are so many benefits to having a birth doula and a postpartum doula. And I think it's just having someone who, like a therapist, has the toolbox that can help you get through labor and be the emotional and mental and physical support, because you can have your partner or your mom and they may not know what to do. Like,
or say.
Yes. Yeah.
Or get it because you've lived it.
Yes. And I just think having, they almost feel helpless. Like I had so many partners say, I am so glad you're here, because they just felt helpless. And I could, teach them that I'll massage the mom's back, and then you come do what I'm doing so that you're here for her, and just kind of giving them the tools and holding space really for the birthing family.
It's like a cheerleader of support. And then
absolutely.
You're focusing on mom, because we always say this, like, it's like you give the birth and the baby takes over and no one checks on mom.
Yes. Nope. And so I would stay after birth and like help them with breastfeeding, and maybe get them like blankets or extra pillows or whatever they needed. And it helped the nurse too, because then she could sit and chart, and I was just meeting like the physical and emotional needs of the family. So yeah, I mean, there's so many great benefits, and you're advocating for the birthing person,
which is huge.
Yes, so if crap's hitting the fan, you were there, and maybe we can take a step back for a minute. Like, how are you feeling about this? Like, does she have any options in this moment that she doesn't feel so powerless?
Right.
Just to have that voice that's just for the birthing family.
Because I remember both my experiences, which they both were just like not normal, but it was just like I felt like I was just laying there. Everybody was around me. No one was talking to me. Everybody was talking at me or about me.
Yes.
And I was like,
that's isolating.
I'm a person.
It is. And I'm very thankful that with my traumatic birth, my second birth, I had my husband with me, but he's a CPA, so he's like,
well, my husband's a physician, and he was just like.
But my sister was with me, and she's a labor and delivery nurse, and I can remember just locking eyes with her, and she's like, you're okay. It's going to be okay. And I remember just thinking like, okay, if she says it's okay, then like I'm okay. And I had peace in that moment. Just
you needed reassurance.
Like we were just, the room was filling with people, and it was scary. And I was like, I trust you, and you're looking at me. Like no one else is like looking me in the eye.
No one looks at mom.
And she's like, look at me, like you're good.
Yeah.
You're going to be fine. Baby's going to be fine. And it was just, I was like, okay, like we're good. Like we can get through this.
So that's who they are. And then so if a mom is like, that's the first thing I've ever heard, how can they find a doula in their city, or how can they have one for at home? How can you give them help of how find that?
Again, the internet is a wonderful and a terrible place.
Yeah.
But do that Google search for doulas in your area.
Okay.
I know now we have like local midwives, which is amazing.
Yes.
I think they're doing so much good in the community.
Agreed.
Reach out to local midwives. They're a great resource to find a doula. I don't know that insurance really covers one, which I think is very unfortunate. I think it's a disservice to moms. I think we would have better outcomes with birth doulas and postpartum doulas. But I think it's great at your baby shower if you want to ask for a gift certificate towards a birth doula or a postpartum doula.
Absolutely.
I think that would be
we don't need the 50,000 onesies. Let's talk about what you actually need.
No, you don't need the receiving blankets. Make a sad little
you
quilt
know,
on the ground. You
that we
that
all
my little soapbox of don't give me 100 baby blankets.
Or just like let me or ask me. Ask the mom.
You know what I love to give moms at baby showers is like a manicure, a pedicure.
I love
like
a good
something
service
for mama.
I love
Yes.
a service gift. That's all.
Well, you know, my go-to has been the Podster.
I love the pods.
I mean,
What is
And I
that?
passed it on to.
That's right, you did.
Yes.
What is
Okay, so
this?
I think they've since like recalled and pulled them off the
Of course
market.
they did. Of course they did.
So
Take everything we
With the
love.
rocket
I know.
play, with the DockATot.
Yeah.
Like,
I
I
mean,
mean, come
so
on.
similar concept. You're mixing a DockATot and a boppy.
Okay.
So it actually has that kind of horseshoe shape, but the cover makes it come all the way around. And it's this amazing little kind of angular nesting that you put your baby in.
Yeah.
So you can put your baby down and go pee with, both
Right.
hands.
So my
Right.
friend, it's funny you say that because my other friend
Mhm.
Whitney was gonna list her podster on like Facebook Marketplace, and she's
Yes.
like, "I'm afraid I'm gonna be mom shamed. Like, I think I'm just gonna like toss this because
Oh,
Yeah.
bless
it's
her.
such a great thing." But
It
I think
is.
it was recalled.
My
so.
2-year-old still sleeps on hers, but she's the one with the ear
pillow,
problems.
yeah.
Well,
It
because
is.
the elevation helps.
It is.
And I had to do
Yeah.
it with both my boys' reflux babies. I mean, I was
Yes.
like lifting up people are like, it doesn't, pediatricians say it doesn't make a difference. I'm like, okay, yes, it does.
Yeah.
I'm the one who's waking up at night. I know that one helped.
Yeah.
Even if it just did for my heart
Yeah.
and
Oh, yeah.
sanity,
So for me, it was a place where I could lay my baby down.
which is important.
Yes, it was a safe space.
You have to be okay. Like,
and so,
permission, lay your babies down.
Yes.
Yeah,
It's
like
fine.
I could go
Yes.
eat, I could go shower, and I could see her in her podster. Now, mind you, did she sleep in it overnight? No, she did not. That was not safe sleep, and I was
Right.
very, y'all know this, very Sid's
Yes.
anxious.
Yes, you are. Yep.
So it was not an overnight thing, but during the day, if she was napping in it and I was awake, I'm like, heck yeah, I'm gonna go get a shower.
Yeah, that's
Like
okay.
pull her into the bathroom
Yes.
with me, can peek out the shower.
And this
Okay,
is
cool, you're fine.
something else that, like, as a lactation consultant, I tell my moms because sometimes, we are told in the hospital, feed your baby every 3 hours. Well,
Mhm.
newborn babies want to eat every hour sometimes.
Yeah.
And moms get so overwhelmed. And I'm like, if your baby you've changed their diaper, you have fed them, and they're crying, and you need a minute, lay them on their back in their crib,
Yeah.
close the door, and give yourself a minute. Like,
Yeah.
this is your permission.
Yeah,
It's
you're allowed
okay
to do that.
to
Yes.
take a minute to catch your breath, and healthy mom, healthy baby.
I
Yes.
always know my boys responded to my angst, anxiety, stress. And like, I remember sobbing a couple of times, and they would just get escalated because I was like, they felt me.
Oh, yeah.
And I should have just said, okay,
Let me
5
just
minutes,
take a
Sarah.
minute.
They're safe. They're
Yes.
fine. But again, no one
And
tells
at
you
that
this.
age,
And
they
no one
can't
says,
run away.
No,
So you can
exactly.
just lay them
Exactly.
down and take your 5 minutes, and they're in the same spot.
Toddlers run
Yes.
quickly.
Yes, but sometimes it's okay if they run away as long as they're safe.
Yeah, baby gates.
Yeah, it's okay.
Trapped area. It's
all good.
fine.
Yeah.
I say that all the
The
time.
playpen.
Yes.
Love
Yeah.
it.
So, guys, we just want you guys to take away from Jenny's conversation that she is a mom like us.
Oh, yeah.
She had some unfortunate birth experience,
Traumas.
like a lot of us. The breastfeeding struggles, the mastitis, what we want moms to have and support. She's out there doing.
That's
and
right.
our Previa Alliance women who are enrolled, they are so fortunate to have you both's videos. I'm telling you, and we're working, listeners, to get this to more women
Yay.
out there. But Jenny, will you give us for Instagram, we're gonna post tips, lactation tips,
Yeah.
doula
Heck
tips,
yeah.
what moms
Yes.
actually need. And we'll post all this with this
Yes.
episode.
Mhm.
So, because I know, guys, you guys are probably in the car listening. You're maybe put away dishes.
Yeah.
You're like, I don't have time to write down all these
Yeah.
magic pearls. We will put this on some posts.
Yes.
Heck yeah.
Just some quick tips for latch, increasing your
Yes.
milk supply, maybe decreasing your milk supply.
Yes.
Hello.
All the things.
Clogged ducts,
Yep.
all the
Yes.
things.
How to dry it up if you want a formula
Totally.
feed.
Yes.
Because that's
absolutely.
really hard to dry up.
Yes.
Yeah, it is.
And it hurts.
Especially for the second child for some reason. It was much easier with my first.
It's like your body knows,
Uh-huh.
I've done this before.
Yeah.
The milk comes in
Ew.
harder that
Yeah.
that when you're fixing to oh my gosh, I was just like, please come on
Yeah.
in. When it engorges. But
Yeah.
well, Jenny, we're obsessed with you.
Oh, I
You're the
love you
cutest.
guys. Y'all are the best.
And
Thank you for
listeners,
having me.
send us in questions. We can always send it to Jenny and we can get you guys some good answers.
That's right.
All right, till next time.
All right, see ya.